10 types of dementia explained. Dementia, Alzheimer's, senility, forgetfulness, all of these words point to an experience. But do they point to the same one? Are they different? Are they the same? I often hear these words thrown around interchangeably. Here I hope to give some etymological clarity. Aging in America is confusing. By using clear language, I hope we can communicate more effectively about our experiences. Through sharing experiences, we also share wisdom to age more playfully. My training is in the field of psychology, which uses the DSM as its diagnostic manual. It's based on that I'll share the different types of dementia, or as it is now clinically called, neurocognitive disorder. That brings us to our first language issue. Dementia, or neurocognitive disorder, are interchangeable and are overarching terms for everything that is about to follow. What we're about to talk about next are all types of dementia, or subtypes of neurocognitive disorder. So whenever you hear someone say dementia or neurocognitive disorder, think of that as the umbrella below which there's lots of different subtypes. After someone's determined to be experiencing dementia, a subtype allows the experience to be further defined according to the known or presumed cause, as well as the main characteristics, timeline, and symptom set. Knowing a subtype can help give behaviors meaning and offer understanding, as well as offering a way to share best practices for living with dementia. There's a wealth of research on each of these types. Below is a very basic overview meant to be used as a starting point of understanding. The first subtype of dementia is Alzheimer's disease. Alzheimer's is named for the doctor who found the pathologies believed to be its cause. Although the exact cause for the behaviors labeled as Alzheimer's is still unknown, it's thought to be inherited genetically. Alzheimer's varies from other dementias in that it progresses at a steady and gradual rate. For a diagnosis of probable Alzheimer's, probable because the tangles from which its name is derived can only be verified during a post-mortem brainopsy, there must be a decline in memory, learning, and one other domain of cognition. Second type is frontotemporal dementia. This is a dementia named for the part of brain it affects the most, the frontal lobe. Frontotemporal dementia seems to appear suddenly and then progress gradually. There's a behavioral and language variant. The behavioral variant is marked by disinhibition and changes in social behavior. The language variant results in dramatic change in language, ranging from speech production to word comprehension. The third type is Lewy body disease. This is also named for its assumptive cause, Lewy bodies in the brain. Those with Lewy body disease experience fluctuating cognition levels. This disease is also marked by detailed visual hallucinations. These hallucinations are not psychosis. Unfortunately, antipsychotics are often given to treat these hallucinations. These drugs are contraindicated or not recommended for people with Lewy body diagnosis and can actually make the symptoms worse. Lewy body also has features of Parkinsonism and is oftentimes misdiagnosed. There are more physical changes associated with Lewy body than any other dementia. The remaining types are named for their cause. Their exact symptoms may vary based on the area of brain which was damaged and how extensive the damage is. Neurocognitive disorder due to vascular disease. The onset usually coincides with a cerebrovascular event, a disruption of blood to the brain, such as a stroke. Neurocognitive disorder due to traumatic brain injury. There must be evidence of an injury to the brain, such as an impact to the head, either at a single moment or repeated over time, such as multiple concussions from playing contact sport. Substance or medication induced. Damage has been done to the brain through the use of substances or medication. The symptoms remain after the usual duration of intoxication or withdrawal has passed. Neurocognitive disorder due to HIV infection. There has to be evidence of HIV infection, and dementia is not better attributed to another type. Dementia due to prion disease. There must be evidence of prion disease as well as rapid progression of neurocognitive disorder symptoms. Dementia due to Parkinson's disease. The Parkinson's must be present before the dementia. And finally, dementia due to Huntington's disease, where the Huntington's is diagnosed before the dementia or there's a family history or genetic testing to support the diagnosis. In addition to these 10 types, there are also diagnoses of neurocognitive disorder due to another medical condition, as well as neurocognitive disorder due to multiple etiologies, meaning that more than one of these types are present at the same time. Remember, every person is unique, and so is their experience of dementia. Understanding these broad categories can help us share experiences and find helpful resources. Only a medical doctor or licensed mental health professional can offer a diagnosis. These same people can be very helpful in connecting you to local resources such as support groups, therapeutics, educational program, and medical resources.